Hey everyone, Lamar here with the Healthcare Digital Marketing Podcast. I'm super excited about this episode with the legend Ali. I'm excited to have him on, and he's got a very impactful episode here just to really get into the legal space for dentists and medical practitioners. And so, Ali, before we start this conversation, really, you and I met through a mutual friend. He's a great guy, and so name's Justin, and Justin was on the episode. Well, he's the last episode actually, and
Oh, is that
great guy. But I know you and I met through him. But open up and tell the audience a little bit about your background. I know you're an attorney, but that's about all I know. Just give us some more context on what you do from a legal standpoint and all the other amazing things you're involved in.
Yeah, no, thanks, Lamar. And yeah, and let's not stroke Justin's ego too much. You know how he gets.
Yep, exactly.
uh, but no, it's thanks for inviting me on the podcast. And like you said, I'm a healthcare lawyer. We focus a lot on dentistry, optometry, and vet. But what we did a few years ago is we saw this trend with a lot of our doctors where they were being sued by their employees. And what was kind of crazy about this, Lamar, is that they're working so hard for so many years to get through school. They get through that, they take their boards, they come out and associate for a while, and then they know they want to be practice owners because it's such a great way of getting to financial independence. But once they get into it, there's really no one to help them at that point. And the dental schools try their best, in terms of teaching, business skills, but the reality is they don't really have the time in a 4-year curriculum, or if they're at UOP, a 3-year curriculum, to be able to teach all the business stuff, especially something as specific as HR.
Right.
And so we created this online platform called HR for Health, with the primary goal. I mean, the primary and honestly, the only goal initially was to get them compliant, right? Let's just make sure the basics of HR compliance so that you can do what you need to do, and then we'll go back and focus on marketing and focus on the clinical side of your practice versus worrying about all the nitty-gritty stuff. So
no, that's awesome. Thanks for sharing that. And so how long have you been practicing? Where are you currently located, and where do you practice?
yeah, so our law firm is based in California, but HR for Health, which is its own independent company, works national. And so we have clients in, I think, 47 of the 50 states. And so we've got a national platform, all of the documents that we have on there, the employment manual, all the new hire forms, termination forms, performance reviews, they're all very state specific because,
Awesome.
as state laws change, right? And they're different. So yeah, they're very state specific and unique to each practice.
Oh, that's awesome. And so, like, when did you actually start HR for Health? Like, how long has it been around?
Oh man, so it's been like 7 years now. We spent a couple of years in development and testing and whatnot, and then we did like a soft launch. But I would say it's about 7 full years that we've been out there, and we've been really blessed, Lamar. I mean, it's we've gotten state endorsements from a bunch of states. We have a lot of really great partnerships with some of the biggest sort of dental and medical companies out there and whatnot. And then of course all of our partners and relationships that we have across the country, like with you and others. It's been a lot of fun.
No, that's awesome. And so you mentioned earlier that, and this is a big problem, right? Like if your employee is suing you as a practice owner, but what other reasons are you seeing why dentists or physicians should care about HR?
Yeah, I mean, it really kind of falls into 3 buckets, in my opinion. So the first bucket is the one you just talked about, which is the legal bucket, which is all about legal compliance. I mean, HR is all about legal protections for the employees. I mean, the rules, the laws by the federal government, by the states, and sometimes even by the counties, believe it or not, have been created to protect the worker. And
Yeah.
so right off the bat, that legal compliance needs to be in place because there's a lot of exposure. There's penalties for not giving breaks and lunches on time, not paying overtime, not giving the right documents when you're terminating somebody or hiring somebody. So having that in place, I think, is very important. Once you have all of that in place, then you move to the second bucket. And the second bucket is one where it's really about maintaining your current employees and improving your current employees, right?
Right.
And and you know this from your, from all the marketing strategies that you put in place. It's not just about bringing in new patients, right? It's although that's important, and the same thing on the HR side. It's not just about hiring new people all the time. It's about making sure that your current employees
Gotta
are
retain them.
doing well, right? Exactly. It's like internal marketing, right? You want to make sure your current employees are doing well, that they're thriving, that they're that they know where their progression in their career is going, but then more importantly, that they understand how to succeed in your practice. And so we've got a lot of tools, like performance review tools, performance management tools, a lot of artificial intelligence type of things that we've put in place that really help make sure that the team not only grows to be strong, but stays strong over time.
Right, right.
So,
That's awesome. That's awesome. Sounds like there's a lot of valuable assets within your platform to really help these business owners to succeed and really help their, their culture, in a sense to,
yep.
keep people happy, keep people at their practice. So when it comes to the overall, I guess, like you mentioned earlier, a lot of practice owners are in school. They're not learning, how to, handle the HR side of things. So what are some issues you're seeing from these practice owners, reason why they're sometimes not even tapping into that part of their business?
Not tapping into the HR side, you mean?
Mm-hmm.
I think it just has to do with the fact that there's so much new information that's thrown at them, especially now with COVID being sort of where it is. There's so much new, information being published or laws being passed by the federal government, by the states, by the counties, that it's hard to maintain and keep up with all these rules.
Right.
And I mean, look, at the end of the day, I'm a lawyer, right? There are things that I know nothing about, like marketing. And so I hire marketing experts to help with marketing because I can fake it, but it's not going to be as good as hiring someone who's going to really do a good job, right? And you've done that for so many of our clients. And so on the HR side, to me, it's like the same thing. It's like, if you're a doctor, that's your specialty. There's no way, no matter how hard you try, short of retiring from your practice and just becoming an HR expert, can you keep up with all of these rules? And it's funny because there are lawyers out there who, we've seen, also try to do this, and even they have sometimes a hard time keeping up with all these rule changes. And so it's just easier to hand it off to somebody and say, you know what, I'm going to outsource this to the experts. It's very little money in the long term, but it's an insurance where you're going to be protected, and the likelihood of getting in trouble is so much lower.
Yeah, I love what you just said there, and it's so funny to really give a shout out to Dental B School. So really, like, there's a message on there if you can listen to it about marketing. And so with that message is exactly what you just said. From a marketing standpoint, practice owners cannot try to run their marketing campaigns. There is just too much information. The algorithms change. The audience targeting shifts with these platforms. So hiring a technical expert to come in and help you run those campaigns, but align your vision and your goals with the strategies that's the key to it. So you can focus on running your practice, managing patients, and also really evolving your culture. So you hit the nail on the head with that. And I think that's where practice owners get in trouble, right? Like where to the point where you're talking about eventually getting sued and not having any legal or HR support behind that. When it comes to, I guess, main questions or roadblocks that you hear as it relates to HR, what are dentists telling you guys? Like, what are they talking about when it comes to, like, what are the questions are they asking before they use your service?
Well, I mean, I think people, when they approach us regarding HR, I think they know that they need it because it's kind of like HIPAA compliance or or OSHA compliance, you know that you need HR because you have employees. You know you need a good payroll product, and things of that nature. And so the questions really are more about how can you keep me safe, right? Like, what are the things that are unique about your software that can keep me safe? And what our team really talks about is the fact that we're very industry specific. So we don't have dry cleaners and coffee shops and tech companies as our clients. We just work with dentists and optometrists, veterinarians, and other doctors. That's it. So we know the industry inside and out. So when somebody gets in trouble with their optician or with their hygienist, we know how to overcome that. And so we've put things in place in the software to protect against the most common types of issues. And so the software is very smart in that sense. And then the next questions usually have to do more about, well, if what tools do you have beyond just the software to help me stay compliant if I have questions? And what we do for them is we give them an employment manual for free as part of our software. That's a huge thing, because a lot of lawyers charge $3,000-$4,000 to put an employment manual together, and so that we just give it to them, and it's a huge value, and it's not a form, it's customized for them. So we help them put in all of their details, their benefits, their office hours, what's unique about their offices. We put all of that in there, and so we just hand that to them. The second thing is, they have access to HR professionals and lawyers who will answer their questions. And Lamar, I can tell you, this is one of the most used portions of our site, because questions come up. Like if you have a question, tomorrow about, how to, let's say, terminate an employee, or how to, admonish an employee who maybe, is repeatedly coming late. I mean, you would call me, of course, and I would advise you. But if you didn't know me, well, you wouldn't know where to go. Right. And what are you going to do? Pick up the phone and call some random lawyer who's not going to know anything about anything about your practice? Well, that's where that support really comes into play. And our HR advisors and our lawyers who work there really have established really great relationships with our clients, because a lot of times, the questions come up. It might be once a year, it might be a couple of times a year. So that's two of the tools. And then something really exciting that I don't even know if I've told you yet. So we created our own payroll, as you know, a couple of years ago, and that's been super popular, and people love it because, it's inexpensive, but more importantly, it's better service than any other payroll company out there. But here's the exciting part. And we haven't really made this public yet, but I'll tell you what it is. We have negotiated a deal with a 401k provider whereas we are providing a 401k plan equivalent to as if we had $1 billion under management. So what that means is that we have some of the lowest rates for clients, and we just saved the doctor, just a couple of weeks ago, over $3,000 a year in fees that she was paying for her 2 offices to this 401k provider. For just switching over, and now she's going to get those low rates forever. And what's amazing is, man, that's $3,000. That's a really nice vacation,
Right.
So and for doing nothing, right? Because these are just fees you pay. It's not like you're getting better service or more of something. I mean, it's a 401k plan. So that's really how we differentiate ourselves, and we've been really blessed in being able to do that across the country.
No, that's awesome. So it sounds like you guys really help with payroll now, HR support, legal advice, and documentation and all that good stuff. I guess back to that question of, do you see dentists or medical practitioners come to you when there's an issue, or do they typically come to you when they're like trying to get ahead of the game? Because sometimes, like with marketing, like they're 6 years in and they're getting referrals, but now like they have 3 other dentists down the street that's competing, and they're losing their patient flow. So then they're like, okay, now I need marketing. But if they'd have done that 3 years ago, 2 years ago, whatever, they would have been ahead of the game. So I'm just curious, in your field, Do you typically see it, ahead of the game, or is it, I'm trying to put a fire out, I need HR or legal
Yeah.
advice?
Yeah, no, that's a great question, and I'll tell you, I mean, I don't know the percentages exactly, but I tell you, it's probably 60-40, where 60% are coming to us because they're thinking ahead and they're planning ahead, and they're either getting ready to own a practice, or they own a practice and they know this is an issue and kind of weighing on their shoulders, and they just want to take that monkey off and just kind of be free of that stress, and so I think that is about 60% of people. And then there's 40% that you're exactly right. Something has gone wrong. Either they've gotten a letter from a lawyer, or their employee has gone to their state, or filed a complaint, or whatnot. And now they realize the importance of HR. And I think the 60% that are kind of think this through long term and are planning ahead, one of the things I think they really want is they want that relief, so that they know that's taken care of, so that they can get back to being a doctor and working clinically. And I'm sure you see the same thing, because like you said, a lot of people want to do more marketing, they just don't know where to start.
Yeah,
And and it's kind of sits in the back of their minds that I got to do better, I got to do more, I got to do this, I got to do that. But once they actually hire you, right, and like they do us, suddenly it's like this relief, right?
yeah,
It's like
yeah.
I'm done. Like, now I've got an expert to do it. I can get back to what I do best, and I'll let them kind of do their job. And of course, then it's on us and it's on you to make sure we deliver.
Right.
But we do deliver, and that's the exciting part.
Now that's awesome. And I can see the way HR and marketing work together, because if we're delivering new patients through, SEO, ranking them in Google, Facebook ads or Google ads, targeting a specific audience for them, if they're getting new patients and they're losing internal staff members and
Yeah,
there's no HR guidance or legal advice happening in the background, what's going to happen is they're going to lose new patients too. So they're wasting
yeah.
their marketing dollars. So I'm just curious, like, do you ever see that sometimes where it's, they understand the importance of marketing, but they're not understanding the importance of, a HR solution, so that they can make sure every patient that comes through their door, they're seeing the same people, so that it's not high turnover. And then, there's just like lost conversations or lost experiences. So I'm just curious if, any conversation you've had with dentists as it relates to the HR and marketing aspect.
Yeah, no, you're hitting it on the nose. You're hitting it on the nose here, because you know you can do all the marketing you want, and you can get 100 new patients a month, right? But once they come in, if the patient experience is not there, then those patients, they might sit through that first appointment, but they may not stay there long term, right?
Yeah.
And so you're working like doubly hard to bring in more and more new people all the time, but you're not really doing a fantastic job of keeping the new patients that you've gotten, right?
Right. Right.
And and a lot of that goes to the team, right? Goes to the team. And it's funny, in my seminars I talk about this a little bit, which is that you know uh, the patient experience, how the employees treat the patients, is really the number one factor that I have seen in my years of practices that grow heavily versus ones that just kind of meander, right?
Right.
Because if you're all about customer service, you can't force that on your employees. They have to want to feel it, right? They have to feel like you love them, they love the practice, that they love the patients, they love the belief system that the
Right.
doctor has and the practice has, and they want to show that to the patients. And so a lot of that comes down to HR, because how do you show love to your patients? Well, you show them love by saying, hey, here's an employment manual that is up to date, has all your benefits. You show them love by making the process of benefits tracking easy, so they're
Yeah.
not guessing, right? They're not guessing how many vacation days they have and how many sick days they have. They have it on their computer screen, which is our software. You
Right.
show them love by respecting them and doing performance reviews when the time is right, and helping them grow. So that's how HR and marketing really kind of marry one another, and really can thrive, when people are thinking about it in the same way.
Yeah, that's awesome. And I guess in closing, so if there's a new dentist, right? And or let's say to your point of 60-40, right? 60 are ahead of the game, 40 are, waiting on that fire to happen. If there's a dentist that's in any of those buckets, but they're listening to you today, can you talk about in closing, is your software affordable for them? Because a lot of startup practices, especially, will come out and they're like trying to hold tight on expenses, but there's things that they need to do. So I would just
Yeah.
love, some final words from you on, why they choose HR for health and the benefits of it. Obviously, you explained that, but the affordability of it.
Yeah, absolutely. Yeah, we've priced this kind of specifically to be super affordable for everybody. We actually have a package for young dentists who are new practice owners, whether they're doing a startup or an acquisition. And so that program is really intended for folks that don't have a lot of employees, but still need all these HR, rules, to be implemented and monitored and handled, because the HR laws don't really differ in much, in many ways. If you have if you have a low number of employees or you have a high number of employees, they're mostly the same. So we have a special program for them, and then for those that are in practice that have more than 4 or 5 employees, our software is super affordable. It's about $200 a month. If you have payroll, it's a little bit more than that. And so it's really sort of a no-brainer. And I'll tell you, when we talk to our partners, whether it's the state associations or other national partners, everyone says, look, you guys are underpriced. You should increase the pricing for it because of all the stuff that we provide them. And, it's for us, it's not about that. It's not about charging the most. It's about giving the most and showing the most value. And so we're comfortable with where we are, and we've made it affordable for everybody. I mean, Lamar, I rarely get someone that says I can't afford it, because of the way we've priced it. It's super affordable, especially when you take into account payroll. We have a ton of doctors who pay as much for us with our payroll than they were just for payroll with another company, right?
Wow.
And it's like we've combined it, and you get all this extra benefit. I mean, it's sort of a no-brainer.
Wow, that's awesome. And so again, this is so impactful, just the solutions and the value that you can help, dentists or medical practitioners nationwide. So so correct me if I'm wrong, it's not just one segment of the US, it's you can handle nationwide, is that correct?
Yep. Yeah, we're in, like, I think, like I said, 47 or 48 of the 50 states. And so we're in all the, we're everywhere that doctors are. And so, yeah, we're not in one state.
Oh, that's awesome. And so, Ali, if someone wants to contact, you guys about HR support, what's the best way for them to contact you? And we'll include that information in the description as well.
Awesome. Yeah. So the best way is probably go to the website, and that's hr4health.com. So HR and then FORHEALTH.com. And that's the best way. And ask, to speak to one of our, associates. And what they'll do is they'll contact you. They'll go through a really detailed analysis of your current HR situation. And so that includes analyzing, whether you have a manual, what documents you have, what your payroll systems are like. They'll go through all of that, and that will generate a score. And we can give you a score on how well you're doing as compared to, other dental practices or other medical practices, and then with steps on how to improve very quickly. And then we'll help you implement those, and so that you can, fast track, the compliance side of things. So our team is really great in that regard.
That's awesome. So if you guys are listening to this podcast episode, to retain patients, you got to retain your staff. So that's where Ali and his team comes in. Ali, again, thank you for your time today. I'm super excited about releasing this to the world, and we'll catch you guys next time. Again, I'm Lamar, the host of the Healthcare Digital Marketing Podcast. Thank you.
Awesome. Thanks, Lamar. Thanks.
You're welcome.